Joining us now, infectious diseases physician and director of Boston University's Center of Emerging Infectious Diseases, Dr. Nahid Bhadillia. She was also the senior policy advisor for the White House's COVID-19 response team between 2022 and 2023. COVID came up a lot during this hearing. The Republicans using it to say, hey, listen, the response to COVID was not correct. It was overblown. Shutting down the schools went on for too long. Healthy kids do not need the vaccine. And that is why the American public doesn't trust the CDC. I'd first like your thoughts on that, and then broadly your thoughts on the hearing.
Well, let me start by saying, as a responsible infectious diseases physician, that COVID vaccines were really important in saving millions of lives here in the U.S. and including, in some cases, pediatric lives, even though kids are not at higher risk for more severe infections. There are those that we see that can have more severe presentation. And so the choice here is to give the choice to parents to be able to make that. And all the measures that were taken during COVID, we have to think back and not rewrite history and remember this was at a period of time that we're learning about a brand new disease. We didn't have any treatments or any vaccines. But that's not what's going on here. What's happening here is erosion in well-established, decades-long used vaccines. You heard from Director Monterez that she had been, or Dr. Deb Howry, that she'd been asked to downplay the effectiveness of measles and to promote other measles treatments that didn't have evidence, right? Measles, the MMR vaccine has been in use for decades and has been safe and efficacious. We're hearing that potentially hepatitis B vaccine, and particularly the dose at birth, will be under contention tomorrow at the Advisory Committee for Immunization Practices. Since we put that into place, we've seen 99% decrease at the population level for this disease. What's happening here is that you're already seeing growing distrust of the American public in the vaccines because of the dis and misinformation that they're getting. And now we're at a precipice where they might be hearing from a committee that's put together by the secretary that might share information that may not be of the greatest scientific quality.
So if that does happen, what is it going to mean for access to vaccines? People are talking about parents making the decisions they want to make. Will they actually be able to? Will they have the access if they go into their pediatrician for the vaccine schedule as it currently exists today?
Yeah, there seems to be a huge split happening, Katie, where you're seeing many of the states starting to make their own consortia for vaccine policy. You've seen that here in the Northeast and on the West Coast. Actually, one piece of good news is the American Health Insurance Plans Trade Union came out in the last 24 hours to say that they will continue to support vaccines that the ACIP, the Advisory Committee, supported before September 2025 and continue to base their choices of what vaccines they would cover based on evidence. And that's a good thing. But the trouble is, leaving the people wonder about why the vaccine mandates are needed, right? It's because parents are being bombarded by mis and disinformation. There was a Kaiser and Washington Post poll that said 1 in 6 American parents have delayed or skipped doses for vaccines already. And when they hear more of this type of misinformation from the HHS, it's only going to make those numbers worse.
All right, Dr. Bhadillia, thank you very much for being with us today.